All right, well, welcome back. We were here Tuesday, and now we're here for workshop number 2. I think everything is pretty much the same as to what we're planning to do as far as the protocol. So we're going to be muting all you guys in just a moment. We're going to be recording the session, and remember, this is all supplemental, so keep working on that Science of Diving digital online material, so that we can get every one of you complete with your SSI Science of Diving. Okay, yeah, so roll your camera. We'll have the chat running. We'll have instructors watching the chat. So while we may not be able to verbally interact with you during the presentations, we will certainly be right on top of the chats. After our presentation, we'll have the after party where everybody gets unmuted. We can go through review questions. We can talk about whatever you like. Okay, any questions before I turn off the audio?
Dave, I was just going to add that we are putting the recorded sessions up on the website. So if you wanted to review things, if you go under the classes area, you'll see a Science of Diving review session area.
Right, and that's where the recordings from these sessions will be. Okay, mute all. Okay. All right, so our plan today is diving physiology. So we're going to talk about some of the things that will have impacts on our bodies as divers. All right, and first up is going to be Bill Fitzgerald. Yeah, not Bill Fitzgerald. I did not fix that, Bill. Bill Fitzpatrick. Do not pay attention to that slide. All right, so Bill has been diving since 1986, but only in cold water for 2 years when he started with RU for Scuba. Since then, he's been diving in Mexico, the Caymans, Bahamas, Florida, Dominican Republic, Puerto Rico, and his favorite is on the liveaboard boat, the Juliet. When he's not diving, and in order to fund all of his diving activities, he's a cardiovascular RN with 25 years of experience. So who better to talk to us about cardiovascular system? So Bill, you'll have to unmute yourself.
Unmute myself. So first slide there, Dave, please. So this may be a review for most of you, maybe like high school biology or took a anatomy and physiology class in college. So I'm going to just talk over the next 5 or 6 minutes about the cardiovascular system. So pretty much your heart and then all the veins and arteries that go to it and from it. So the heart is pretty much just a pump. It's a mechanical pump as well as run by electricity. Then coming off of that is all your arteries and your veins, and I'll talk about that in a minute. And then we all know that what's carried through that is your blood. Now, one of the purposes of the cardiovascular system is to obviously supply oxygen to all your cells, carry it throughout the heart, throughout the body. And then it also takes all the carbon dioxide that's a byproduct of your cell's activity, and then it expends it out of your lungs. And as we saw earlier, that from yesterday's class or Tuesday's class, we breathe in 21% oxygen, and we actually breathe out about 19% oxygen. We do get a little use of it, and then a lot of it's transformed into carbon dioxide, which again, the cardiovascular system, and as Megan will talk about shortly, the respiratory system eliminates that. Cardiovascular system also carries nutrients to the cells, enzymes, hormones. It helps fight infection, and it also helps clot any cuts that we get. So just had a kind of brief overview. I think everybody pretty much knows what our blood does for us. So Dave, next slide.
You know, Bill, I was afraid we were about to have a moment. So we did.
Oh!
So everybody, please hold. All right, I will unmute everybody so you can talk amongst yourselves. There you go. All right, I'll be right with you.
Yeah, this happens about 1 of every 5 sessions I've gone to in the last month.
When I saw the first slide, I'm like, uh-oh. That's not the right one.
And by the way, welcome folks who couldn't make it on Tuesday. I see a couple of folks on there. So, yeah. So, and I don't know if you caught it before, but the other sessions are recorded and we put them on the website so you can watch those. And the idea is we're not going through slide by slide teaching, right? The materials are online in the Dive SSI app or on the website. And so this is more of a kind of a highlights of the session where people can ask questions. And there's a social aspect of this too. So a bunch of divers can sit around and talk about their experience as well. So we tend to open up at about 8 o'clock or so and for kind of a round table for questions. And Dave, have I tap danced enough for you? Or should I keep on going?
Just a little further, Jim.
Okay.
I found it on YouTube where you can go right to YouTube and get the class we had today.
Yes, our YouTube channel I think had 3 videos on it, and I think we're up to maybe 4 now with 6 views prior to this. So I just linked back to YouTube is what really goes on behind the scenes. But yeah, thanks for it.
All right, there were these 2 guys drinking at a bar. No, I better not go there.
Anyone going to any place cool once this this COVID thing gets behind us?
Grocery store.
Grocery store. Let me say, is anyone going to any cool dives? I'll put it that way.
Well, mine got canceled, so.
Yep.
I have a Bon Air.
Kelly's.
I know.
Well, you were supposed to be. Was it next week? Was it?
Yeah, Saturday.
Yeah.
Saturday.
Like 2 days from now.
Yep.
Well, the beautiful thing is the way the weather is. You can just go outside and go diving. As much rain as we're getting today.
Oh yeah, the water
I'm in my
temperature is so
backyard now.
close.
It is close.
Yeah, Little Cayman, Lake Ontario, Canandaigua Lake, they're close.
Yeah.
Same difference, right?
Yeah. 30 and 30, just different measurement system. 1 Celsius, 1 Fahrenheit.
Well, the sad thing is we were doing this trip with this group of people that we met before, and we were celebrating this guy's 90th birthday.
Woo woo.
And he's still diving. Yeah, he turned 90 in March. And it was kind of a bummer that, we didn't get to go and do it.
Right. Yeah, so we can be also lucky, right? At 90 and still diving. How great is that?
Yeah, I know it.
Is it perhaps because he's a good cardiovascular system? Take it away, Bill.
Could be.
I'm waiting
Bill's
for
got
the
a lot
next
of money.
slide. Is where
Oh,
things
okay.
got hung up.
All right, you want the next slide, Bill?
Yes, please.
Okay,
Hey,
let's go with the
there
human
it
heart.
is.
Okay.
Back to mute.
Don't have one of those.
Yeah, some people you don't think they have a heart, but everybody does. And everybody's works the same way. So if you look at it, up on the top, kind of where the red and the blue at the very top of the heart, that would be the low pressure side of things, much like your second stage. And then on the bottom, where you have your ventricles, the 2 lower ones, that'd be more the high pressure. So if you start where I have the arrow start here, your blood comes into your heart from either the superior vena cava or the inferior. It flows in from either the lower part of your body or from the upper part of your body into that right atrium. So your heart fills into there. So we'll start on that side. And as your heart contracts, the blood goes down into that lower part, into your right ventricle. And then it pushes it up into with the left and right pulmonary arteries that go into your left and right lung. Right there is where the carbon dioxide is eliminated, oxygen is taken into the blood, and then it comes back over on your right side, which is the left atrium, comes into there, and then it goes down into the left ventricle, and then out into your system, up into your aorta, flows up into your carotid arteries, down through the aortic arch, over to the top, down to your into your bifurcation where it splits to your kidneys, and then further on down into your body. Now, a lot of people hear, that lub dub of the heartbeat. The lub is actually that part you can see on the screen where your tricuspid and your mitral valves are closing.
Hey,
Bill, you're muted.
Oh, you ended up muted.
Okay, where did I leave off?
It's where two words that I didn't understand came together.
The sound of the heart.
We'll go ahead.
Had a
So
little
the love dub
right
part
there.
of your heart, we'll skip over there, is pretty much those valves opening and closing. They're one-way valves, so things don't flow backwards. They flow the right way into your heart or out of your heart. Heartbeat normal is 60 to 80 beats per minute, but your heart can also compensate if you're under stress, if you're running, if you're diving and you're swimming harder. The heart can actually, as you know, increase its heart rate, but it can also increase how it contracts to push more blood throughout the system, which goes to the next slide, and I hope to God that it's there.
Yeah, it'll be here because this is your deck.
There we go. So the heart, once it contracts, once it's pumping blood out, it pumps it out into your arteries. So all the red is your arteries. And you can see the most important thing is it comes right off of the heart, it goes to your brain. The body protects itself. So the most important parts of your body get the most blood supply. So you can see it goes to your lungs, it goes to up into your brain, and as it goes down, it goes into your kidneys, and then splits off down into your legs, into your arms. The arteries have a lot of muscle around them. So they can contract, they can dilate depending on if it's cold, if there's a problem with your body, if you're hemorrhaging, the body can start shutting the lower parts down to protect itself. So you keep getting the blood supply to those important organs, mostly your kidneys up into your lungs, and ultimately your brain is the last thing that the body protects to keep things running. So as the blood travels throughout your body, it goes through the arteries, it goes down to the very small capillaries, and we'll look at that soon, where everything is, the oxygen is given to the cells, carbon dioxide is picked up from the cells, then it travels back up through the heart. As I said, you can see into that upper vena cava, superior vena cava, the inferior, and then it cycles it back through your heart again. And your heart just constantly cycles, keeps cleaning that blood, keeps taking care of the oxygen, the carbon dioxide to eliminate everything. Next slide. And then we can see here on the more of the cellular level where the blood comes in from the heart on the red side, the left side, picked up in the capillaries, there's very small parts of where it interacts with the cells, waste, carbon dioxide, it gets taken out, back into the vein, goes through your heart, taken care of through your lungs, cleansed, more oxygen, everything is cleansed through your kidneys, through your pancreas, all those different areas that keeps the blood flowing and keeps it clean. I'm running out of time, I know, so the last slide. Now this is very interesting. This is one of the things that SSI mentions a lot, is a patent foramen ovale. So when you're inside your mom, when you're developing fetus, your heart actually has a hole in it, and which can be seen there. Because you're not breathing and your mom's breathing for you and giving you that oxygen, there's no reason for your blood really to circulate through your lungs. So it passes from that right to the left into your system because it's already oxygenated by your mom. When you're born, hormones close that little opening. Not for everybody. 10 to 30% of the population, actually that doesn't close all the way. And there's varying degrees that it can be done by ultrasound. You can see how much that actually is open. The problem with diving comes in here. So if you're ascending too quick and you have some nitrogen bubbles in your bloodstream, usually they get taken care of at the capillary level. It goes into your lungs. You can kind of breathe that out. But here you can see where it actually doesn't go into your lungs. It actually passes from your venous system over on the left, right over to the arterial system. So that gets pushed out into your brain. So that's where you have that decompression injury, that those bubbles start getting very big. They're not eliminated through the capillaries or through your breathing, that those bubbles getting larger and larger go into your brain, which would cause an aneurysm or a stroke-like symptom because of that patent foramen ovale. Most people don't even know they have it, or they have a shortness of breath that they would go to their doctor and then get diagnosed with that. And in a very brief 6 or 7 minutes, that is what I have on the cardiovascular system. Moving on to the very close thing would be Megan talking about the respiratory system. Megan, known her for a year. She is a wonderful instructor. I think she really just loves to teach. She always see her in her dry suit. She definitely loves to travel. I don't know so much about going to Canada, but she definitely enjoys diving in the colder weather up here on the north. And I'll pass it over to Megan, I guess.
Alrighty, thanks, Bill. Love the introduction. And we're going to start off with the respiratory system. There's several topics here. A lot of things tie into each other very closely. So we're going to go on to the next slide. So these are the lungs. They are the primary part of your respiratory system, or they contain the primary part of your respiratory system. So you breathe in your nose or your mouth. It goes down your trachea, down into your lungs to the brachial branches, the bronchi, and then down into the little grape-like structures called the alveoli. As you can see here, it gets very detailed, very small, and covering these alveoli is where your blood meets the alveoli, and we do exchange of gases. So as you breathe in, you collect a little bit of oxygen. Your cells pick that up, your blood cells pick that up, and they give off the carbon dioxide as a waste product. You then breathe that out. However, as we talked about last week, not oxygen and carbon dioxide aren't the primary gases of what we breathe in, our atmosphere, our air. Nitrogen is, okay? So nitrogen is just a commonly occurring gas, not really a big factor in our daily lives until we change our pressures. All right, next slide. All right, so let's talk about our lungs abilities. So you have an absolute flat pancake balloon that's not a functioning lung. All right, that's not a good thing for a breathing adult, but you get a little bit of volume in it called the residual volume. So you've blown it up once, a balloon, and you get a little bit of air popped back in that. That's your residual volume. That's something that should always be there, and if it's not, worst case scenario. So next we get your expiratory reserve volume. This is the breath you let out when you do a deep sigh. That is a reserve volume that you normally don't use, but it's there. Next is the tidal volume, which is typically what you breathe in and out on a regular, constant, happy medium basis. Next, beyond that, is the inspiratory reserve volume. This is your doctor says take a deep breath. Those are your primary lung capacities. The next one beyond that would be total lung capacity. And maximum lung capacity is that you've blown up the balloon and it kind of stretches and stretches and stretches a little bit until it meets the edge. And let's hope you never get to the edge as a diver, because things go wrong beyond there. That's where you get a ruptured lung, pneumothorax. Things aren't going so good at that point. Next slide, please, Dave. All right. So how do we breathe? There's some control that we have that's not typically we have a little bit of control. But for the most part, breathing is a non-controlled, your body does it naturally. It needs to do what it does, so it does on its own without you having to think about it. The primary way of it stimulating itself is it registers high carbon dioxide levels. All right, so that's your body saying, hey, I've got this byproduct I need to get rid of. You're taking out the trash. All right, your garbage can's full. Your body's trained itself, okay, we get to a certain level, we're going to take it out. That's your breathe out. And then the other part that goes into that is low oxygen levels. So your body's like, okay, well, we've got a lot of garbage and we need some cleaning. We need some energy. So the oxygen is the refill of your garbage bag. Putting a new garbage bag in. Next step beyond that is blood pH. So the more acidic your blood is, the greater the urge to breathe is. So carbon dioxide builds up, makes the blood more acidic. That's part of the chemical process that helps trigger the stimulation to breathe. Lactic acid, which is produced by contracting muscles and working muscles and other means, is also an acid that's naturally in your blood system that increases and lowers and makes your blood more acidic. This also triggers it. Now, those increase your blood. More acidity, the faster you breathe. Blood temperature, as you get colder, your body slows its breathing. So one of the things that happens is as you get colder, your body's like, oh, wait, we're losing heat. Let's slow down our breathing. Because as you guys talked about last week or Tuesday, one of the ways that your body gets rid of its heat is to breathe. Think like a panting dog. They don't have the ability to sweat, so they pant. Well, when you get cold, your body doesn't want you to pant. It doesn't want you to breathe too fast either because it's losing too much heat. So it wants to conserve it. All right, this is a survival mechanism, not something you can really control. You can override it if you can think about it, but if you're unconscious, that's not happening. Next slide, please. All righty, so breathing media. What is breathing media? That's the air you take with you when you're diving. All right, whatever it is. So we talked about gas laws and concentration, that you get twice as much pressure at 30 feet of salt water versus at the surface. So at 33 feet of depth, you're breathing twice as many molecules of air into your lungs with each breath. You're also having to expel twice as many molecules. All right. Partial pressures of gases, we've talked about a little bit. Same thing, you're breathing in more gases, you've got to get out just as many gases. But you're breathing in more nitrogen and more oxygen with every breath. And your body likes a happy balance. So it's got to be balanced as you dive. That's part of knowing your dive tables. What's safe? What has history said? Hey, this is okay. Don't go beyond it unless you have more training. All right. The other thing is that as you breathe in more molecules or as you come up, it takes more energy for your body to contract that diaphragm and relax the diaphragm to expand your lungs. So depending on what you're breathing, it takes more effort to breathe. All right. Think of if any of you ever climbed at altitude, there's less molecules there. So your body has to work harder to get more air, enough air to survive. So it's the same thing, except it's the exact opposite, where your body has to work twice as hard to get rid of those molecules. And then effects of pressure. All right, so we've started at the surface, we've got our tank, and we get into the water. All righty, not too bad, going on a dive, going down to see some pretty fish in the Caribbean. And as you're following the fish down, you're going down 33 feet, 60 feet. All of this water is putting atmospheres of pressure on your body. So it's moving the blood from your outer limbs to your chest area, to your thorax. It's putting pressure on your abdomen and on your lungs. You might not feel it, but think like that balloon that was shrinking last week as you take it to depth. That's what's happening to your body in little bits at recreational depths. That's why we have a recreational depth. So that way we can stay safe and our body can compensate for the pressure it's under. All right. And as you can, your lungs are that balloon inside your body that your muscles have to overcome your diaphragm to help it expand. All right. And then for the more pressure that's in your chest cavity, there's less space for your alveoli to do the gas exchange. There's more pressure on your heart. There's more pressure on your blood vessels. And just everything is in a container that's under pressure. All righty. How am I doing? I think that's all I had. Is there one more? Oh, there is one more.
There's one more.
Okay, and I'm going over. All right, so panic syndrome. We know what someone looking like panics. Rapid breathing, wide fearful eyes, dilated pupils. One of the easiest signs to see underwater is there's a lot of bubbles with no dead space where they're taking in a good breath. How do you control it? Same way you'd control it on the surface or in somebody else who's panicked. You try and get them to stop, trying to get them to focus on their breathing, in slowly, out slowly, and don't try and ask them to follow too many commands until you've got their mind working. So 3 or 4 good breath inhales and out exhales before you attempt to give any direction. Alrighty. I think that is it for me. So next is Dave Stickney. All right.
It's me. All right. Thank you, Megan.
Yeah, my man Dave, the Boy Scout leader. Awesome, man. And I'll give it away to you.
All right. All right. So it's September 15th, 2018. We just got finished with a dive on the St. Peter, and we wanted to just kind of blow off some of the gas that we had remaining. And I think some of you are with us in this dive, but we experienced some of the best diving conditions we've ever seen on the lake. It was Caribbean-like. It was amazing. The question is, how did that happen? So the reason it happened was because the week before, cold water was brought up from the depths. It shocked the entire lake, and it killed all of the living stuff that was left there, and it was just crystal clear. So the point of all this, while that was great, there was a reason for it. And the reason for it is the thing that I want to talk to you about today, because we need to talk a little bit about diving in cold water. All right, so I want to start off with a few facts. So air and water are different. Well, that's pretty obvious. So 1,000, how does 1,000 play into that? So 1,000 times more heat is required to warm the same volume of water as compared to air. 25. Water conducts body heat away from the diver approximately 25 times faster than air. And there have been some studies that show that it's more than that. So it may be more like 40 times faster. So these are things we need to know about because they can lead to some trouble for us. So what are those troubles we can have? Hypothermia. So hypothermia, your core body temperature drops below average. We got hyperthermia, and that's when your core body temperature rises above average. We're not really going to have that issue in the water in the Northeast, but that is an issue as you think about how you prepare yourself before and after the dive, right? So you need to think about when you're going to put your gear on, when you're going to take your gear off, because you can overheat yourself and it leads to bad things like, heat exhaustion, heat stroke. We're going to focus more on the diving part of this. Okay, so let's look at core body temperatures and what happens to you when your core body temperature changes. Okay, so 98.6, that's our happy place, right? That's our normal body temperature. If we drop it down to 95 degrees, seemingly not a lot, that is the lowest safe limit really for our core body temperature in well-conditioned divers. We drop it just a little bit more, so 95 degrees down to 93 degrees, 2 degrees difference. You're going to start to experience memory loss and lack of coordination. Drop it down 3 more degrees, it affects your heart, so you're going to get an irregular heart rhythm. And we take it down a little bit further to 86. This is kind of the breaking point, right? So we're talking about leading to unconsciousness, loss of muscle strength, and when you go below 86, that may be a real problem for you. So you could experience death due to decreased cardiac and respiratory activity. Okay, so your body does not want this to happen, right? So there are some things that are built into us to defend your body against core body temperature loss. And the kind of things that need to be protected are going to be your vital organs. So things like your brain and your heart and your liver and your lungs. So what are these defenses that your body has? First off is your body build. So we're not all built the same way. Some folks might be more short and stocky, and others might be tall and thin. So endomorphic and ectomorphic are what they call those. But I believe in your online materials, they'll tell you that the ideal body shape for really defending your core body temperature is circular. Having a round body would be perfect, but we have arms and legs, and your arms and legs act like radiators, right? So they're gonna expel heat. So it has to do with the ratio of kind of your surface area to your mass. Okay, so there's the body build. Okay, then there's fatty tissue. So fatty tissue acts like a blanket that can act like an insulator to keep your core body temperature up. Women have more of the fatty tissue layer. And then if we look at marine mammals, we aren't built like a marine mammal. So marine mammals, they have a significant amount of fatty tissue under their skin, and that's meant to insulate them. Okay, now we get into some of the stuff that relates to what Bill was talking about, which is there's a heat transfer system built into us. So we have warm blood that's going out to our extremities, and then we have blood that's coming back to the heart and the lungs in the veins, right? But the arteries and the veins are right next to each other. In proximity, they're right next to each other. And the body is designed so that we're not bringing necessarily cold blood back into our core, because that's going to lower our core body temperature, right? Okay, then there's a thing called blood shunting. So blood shunting is where your body recognizes that, the extremities are maybe cold, and we want to protect the core. So it's going to try to minimize the blood that needs to get sent out to the extremities. So with blood shunting, less circulation occurs out to the extremities. Your lungs and your liver are going to take on more of that blood that would have otherwise been flowing. And interestingly enough, the thing that will defeat blood shunting is exercise. So in the air, above water environment, if we're cold, we'll exercise to get warm. In the water, exercise will make you colder, because it's going to defeat the blood shunting, and it's going to have to deliver blood to those muscles that are calling for it. Okay, metabolic heat production has to do with how you fuel your body. So what are we eating? Your body can be conditioned to generate heat when it needs to. If you eat those complex carbohydrates, your body can be very effective at generating heat. Okay, and then the last one is increased shivering threshold, which is interesting in that your body also is smart enough to know, I think I'm going to raise, actually I'm going to decrease the temperature at which I'm going to shiver. So, you're going to shiver a little bit later. And the reason for that is that shivering, similar to blood shunting, will make you colder in the water. So on land, yes, it generates heat. In the water, it contracts those muscles that are right near the skin that call for blood, and it cools that blood that comes back to the heart. So the shivering isn't effective in the water. It'll make you colder. So your body has defenses, and it needs to protect its vital organs. Okay, here's another interesting part of all this, I think. So we think about getting cold in the water, jumping into the water and feeling that cold water against our bodies, right? But 25% relates to cold water in the air delivery system. How? You lose 25% of your heat through respiration. So it's your breathing where you're losing your heat in your core body temperature.
So what's he saying?
Well, so what causes that? Well, you got cold water next to your tank, right? So it's cooling the air that's in your tank. You're breathing in pressurized air that's denser at depth, right? And that denser air that you're breathing requires more heat to get it up to body temperature. So it's going to cool you that way. And then there's a refrigeration effect that occurs between the first and second regulator stages that also cools the air that you breathe. So you lose some heat straight away from the breathing. Okay, next up is Jeff Munn. Jeff Munn. Jeff and I, we went through the instructor certification course together, and we've done some diving in the Adirondacks, not the Adirondacks, up on the Thousand Islands, St. Lawrence Seaway. So Jeff is going to talk to us about the effects of increasing and decreasing pressure on airfield spaces. Jeff?
All right, thank you. And my topic also is commonly referred to as the squeezes. And the squeezes is directly related to what Gene talked about so expertly on Tuesday, Boyle's Law. It's the relationship between pressure and volume. And the squeezes are a result of changes in pressure on the air-filled cavities inside of our bodies. So, and this can happen on the descent or the ascent up to the surface as well. So one of the more common ones that everybody is, before you even got into diving, is ear squeeze. You know, the first time you're a kid and you dove to the deep end of the pool and you felt that water pressure pushing in on your eardrums, it might have felt uncomfortable or even hurt a little bit. And you figured out how to deal with that. Well, many people, and I've learned one of my favorite techniques is the Valsalva method, where you pinch your nostrils and try to gently breathe out of your nose. And that helps the pressure on the other side of your eardrum push back out and relieves the pressure. There's many other techniques besides the Valsalva. You can swallow, wiggle your jaw. You can pinch your nose and try to swallow. You just have to figure out what works good for you. And I found when I started diving, it was dump in, start going down, descending. And as I felt the pressure on my ears or a little bit of pain, I would start then. And I found often that was a little bit too late. So I discovered that as soon as my head went underwater, I started working on clearing my, making sure my the pressure was relieved in my ears. I started the Valsalva as soon as my head gets underwater. And that works great for me. Find some techniques that work good for you too. Another one that you should be, practicing with everything is slow descents and slow ascents from depth, which the slowing down your speed helps your body adapt to the changing conditions and the changing pressures. One of the cardinal rules is that if you are congested, don't dive. If you're you go underwater and you can't get you're all stuffed up and everything, and you can't get your ears cleared, and you're feeling pain and uncomfort, you got to signal your buddy. You should be watching your buddy as you're going down. And if it's not working, if it's working, everybody's giving the okay sign. If it's not, you got to tell them ears not feeling right. So you hold off at that depth, try to get cleared up. If you can't, a very simple thing is go up 5 feet or so, and you'll feel the pressure relief. You can work on it, try to resolve the problem. If you can't resolve the problem, don't be afraid to abort the dive. There's no reason that you have to do that dive. So no big deal. Go back up to the boat. Hey, maybe that wasn't the day to do that dive. You can work on your suntan. So no big deal, but don't risk it. Don't risk injuring yourself. Other ear squeezes are reverse block, which what that is a squeeze, but it happens when on your ascent from depth. This commonly happens for people that decide, well, you know what, I'm down in Roatan, my dream trip with RU for scuba, and it's, you know, beautiful weather, awesome diving, I can see forever. I really, really, really want to do this dive. So you blow your nose a lot, you try to get your sinuses clear on the boat, and you think you can breathe through your nose, you think you're okay, you jump in, you do everything, you make it down to depth okay, but now you're swimming around down there for 20 minutes or half an hour, and guess what's happening? You haven't fixed the problem by blowing your nose, but now your mucous membranes are swelling back up, you're getting the mucus in there again. Now you're creating a block that you're not going to be able to relieve the pressure in there. Now as you start to ascend, you have pain and discomfort in your ears. So now what do? If you're down at depth and now ascending is hurting your ears, you got to stop. You got to try to get it under control. Often if you go back down a little deeper and try to fix it, that gets rid of the pain. But that's a bad spot to be in, that you're ascending, you're probably down to 1,000 pounds of air or so, and you're down at depth. Mm-hmm. So you're low at air, down at depth, and you can't ascend because your ears are hurting you. So now you're faced with, do I blow my eardrums or drown? That's a bad day. So you really don't want to do that stuff. And that also can happen if you decide, well, if I take a decongestant, maybe that'll fix the problem. Well, same problem can develop in that you don't know if that decongestant is going to work, and you don't know how long that decongestant is going to work. So again, the recommendation is if you're congested or plugged up and you got to be taking medicine that's that bad, don't dive. Or once you jump in the water, if it's not working out, don't be afraid to abort the dive. You got to be careful with that. Another one is sinus squeeze. You have sinuses in your forehead, behind your cheeks, under your nose, back in your skull, and these sinuses are all connected to your nose and your nasal passages. And sometimes they can get irritated, swollen, filled with mucus, and that also can block the equalization between your nose and your sinuses. And again, the same thing with the ear squeeze is you go through your similar techniques for trying to clear your ears. If it doesn't clear up and you can't fix it, abort the dive. No big deal. Go back on the boat, work on your tan. No big deal until it gets better. So not a problem to be safe, and you can go dive the next day. Not a big deal. Another one is the mask squeeze. One of the great things are for scuba. Jim's got the whole showroom there, and he's got about 50 masks down there. You can try on any one you want and find one that fits right. It's nice to have with less volume in it, less air to affect you. The mask squeeze. And what happens with mask squeeze is that volume of air in your mask, as you jump in the water, you start going down, pressure of the water is pushing the mask in on your face. And that can become uncomfortable, feel like your eyes are popping out. I've seen people come out of the water and they got the big ring around their face that their mask was all pushed in, and their eyeballs look like they're bulging, and all the capillaries in the white of their eyes are all ruptured. They had a mask squeeze. And the simple way to fix that is you blow out a little bit through your nose when you feel that happening, and that equalizes the pressure in your mask, and it all goes away. So that should be a very simple one to be able to fix. And then in scuba diving also, you never use goggles that only cover your eyeballs, because there's no way to equalize that. That's for swimming laps, not for scuba diving. So another squeeze that you will maybe run into, or you could experience, hopefully you won't, is a thoracic squeeze. And Gene's going to talk about more detailed on this in a few minutes, and it really relates back to lung overexpansion. Throughout your training, the instructors are always pounding it into you, don't hold your breath, and particularly when you're ascending, because the same thing when we talked about Boyle's Law on Tuesday, the pressure volume relationship. You hold your breath and you start to ascend, your lungs are going to expand, and they can only expand so far. So always make sure that you got bubbles coming out of your mouth all the time, particularly when you're ascending. Some less common squeezes that you can run into is tooth squeeze, where you might have a filling problem in one of your teeth, or you have some tooth decay, or something's going on, or you're cracking an air pocket in there. And that little bit of air in there, believe it or not, can create some pain for you when you're descending or ascending. So if you experience a tooth problem while you're diving, there's not a whole lot you can do. You could try to suck it up and it's going to be a real painful dive, or screw it, you abort the dive, back on the boat, work on your suntan, go see a dentist and get the thing fixed before you dive again, because it can be very painful. Another one you could run into is that gastrointestinal squeeze, where say you're down in Are You for Scuba trip, we went to Roatan, beautiful place, you want to be diving every second of the day. They take you out in the boat in the morning, you do a couple dives, they bring you back, reload the boat, and you have lunch. Well, they had the double bean beef burrito there, and that was delicious. And I decided I want to have a second one, so you wolf down 2. Now you jump back on the boat, and those beans are working inside of you. And it's starting to happen. You get all your stuff on, you jump in the water, you get down to 80 feet, you're swimming around the wreck. Well, those beans are still working on you. You're creating gas inside of your body down at depth. And now you go to ascend, and what happens to the volume of gas inside of your body, according to Boyle? With less pressure as you ascend, the volume increases. So you can experience some discomfort in your abdomen while you're ascending if this stuff is happening. So the big thing to take away from this is when you're diving, don't eat gassy foods prior to diving. You could also run into a suit squeeze, which that's more commonly experienced with dry suit diving. You can have that with wetsuit diving, but most commonly in dry suit diving. And if you haven't experienced dry suit diving, basically one thing you can think about is if you take a plastic bag, you put it over your hand and you dip it in the water, well, all that squishes up together against your hand. Well, can you imagine a dry suit is just like that? If you go down to depth and that thing just starts squeezing in on you, it's very uncomfortable. So the ways that we fix that is, well, first of all, you wear an undergarment that helps, so it's not all squeezed and pinching your skin. And the second thing is you have an air hose from your tank attached to your dry suit. You pump a little air into your dry suit. That air expands it out, gives you that air insulation layer, helps your undergarment keep you warm, and eliminates the suit squeeze, makes it far more comfortable. So you just got to make sure you have the proper fit for your undergarment, and that you put a little air in your dry suit and know what weight you got to be diving. So that kind of concludes and goes over some of the basics on the different types of squeezes you might find. And as I mentioned, Gene's going to go a little bit more in depth on overexpansion injuries related to when I mentioned the thoracic squeeze. So, Gene, take it away.
Having 2 millennial sons, I am very well aware that a lot of folks, and especially the youth these days, are not interested in anything that does not have an immediate application to one's life. And then suggest one learn about this topic is a bit abstract, so you can just forget about it. Tuesday, we reviewed some physical chemistry that probably did not seem particularly applicable to our immediate life. Well, tonight you can see these topics are 104%. Next slide, please. Thank you. Tuesday, I spoke of Boyle's Law, and tonight we're going to see that in action. A full breath of air is, on average, about 5 quarts of air. Never think about holding your breath. Please, just for a moment, though, come with me on a fleeting mind's eye glance of the amount of air that would be in your lungs from a full breath at 99 feet to the surface. The book puts it really well. That's more air than your body can handle. Lungs can rupture if fully inflated in only 4 feet of ascent. Hopefully you will have heard this, and it will be second nature to you not to hold your breath when scuba diving. This is when you're breathing compressed air, and this is so not to cause overexertion of your lungs. There are a couple of situations that can cause overexpansion of your lungs that are not all that obvious. The thing to watch is for the restriction of airflow out of the lungs. And those type of things can be a fast ascent, faster than recommended. Basically, never want to beat your bubbles to the surface. They're friendly. They like the company. Respiratory congestion from a cold or so forth. A respiratory infection, which can have secretions of its own. Smoking, emphysema, chronic or acute bronchitis, tuberculosis, any type of growth that might be in the airwaves, any kind of extra secretions are some diseases that cause there to be leakage in the airwaves, scar tissue, cysts, and very active allergies. Basically, if you're not able to exhale easily on the surface, you should sit out this dive. Now, let's say in that unfortunate situation that there is a rupture or a tear in your lungs. Where does that air go to? And know that there are no immediate symptoms, but we'll return to that shortly. There are three basic paths for air to flow from overextension lung injury. None of them are good or trivial. Recognition and treatment quickly is the key to recovery. As you will read in your material, an emergency room of a hospital is the best place to take a patient that may have suffered an overextension injury. Recompression in a hyperbaric chamber is usually the treatment that is going to happen, but to head off to a hyperbaric chamber facility straight away is not suggested. Often these facilities are not staffed around the clock, and there may be other additional treatment and evaluations that need to be done, and the emergency room is the best place for that. So let your emergency room personnel call, or the Divers Alert Network call, and arrange for the hyperbaric chamber transport and treatment. If any inkling that there is overexpansion injury or decompression sickness, oxygen should always be administered. So now what are these three paths for overexertion injury? There is two types of emphysema, one subcutaneous and one metastatic. The metastatic is where air escapes from the lungs into the area around the heart, exerting pressure on the heart and the surrounding blood vessels. Subcutaneous is that, plus air escapes up the outside of the windpipe in the region to the collarbone and into the neck. And then there's pneumothorax, where air escapes and it goes between the lungs and the rib cage. There can be symptoms such as swelling of the neck, and it feels crackly to the touch. There can be a change in voice and some difficulty in breathing. Additionally, there could be some chest pains and weakness. Blueness of the lips and the nail beds can also be a tip for circulatory difficulties. There are extremely, luckily very rarely, a thing called an arterial air embolism. This cannot happen if steady, rhythmic breathing with properly maintained equipment and well-practiced diving skills are employed. This injury is where the lungs are overextended to the point where the small air sacs in the lungs, called alveoli, are ruptured, actually releasing air bubbles into the circulatory system. This first path out of our heart, as we've heard earlier, is directly to the cardiac arteries to the brain. If you imagine the arteries as branches that get smaller and smaller and finally to the capillaries that are in the brain tissue, these air bubbles that are going along this way can easily stop the flow of blood to this vital organ. Now let's think about Boyle's law again. The pressure of the pressure that the diver is feeling has compressed the air. Let's say the overextension injury happens and the blood vessels are ruptured and allowed air into it. as you go up, those bubbles are also increasing in size, causing even more blockage of the blood vessels and again, cutting off the oxygen supply to the organs. The symptoms for the arterial gas embolism are unconsciousness before reaching the surface or within 4 to 6 minutes of surfacing. Recompression is one of the only sure treatments. Other signs are similar to a stroke with slurred speech, confusion, weakness of both limbs. This deal with both limbs being a problem is very different from the classic stroke symptoms. When studying this advanced recompression of overextension of the lung, some additional good practices surface, pun intended. Along with never holding your breath mantra, smooth, regular breaths are important. Never exhale explosively, as this, along with vertical motion, can cause an unnatural stress on the lungs. Also, common sense tells you to look up when you're ascending. But the fact is that in addition to looking up and not hitting anything, this opens up your airways even further. As a dive buddy, part of your job is to be that outward-looking person looking after your buddy. Note any breathing abnormalities. Somebody holding their breath, you should see that regular flow of bubbles from them. On the surface, if you notice anybody having difficulties that we spoke of here, remember that a cardiac incident may also occur. You should be prepared to administer CPR while waiting for medical aid to arrive. All of this we have spoken about is very easily and completely avoided by simply evaluating your health before the dive and breathe. Just breathe, easily and continuously. That about sums this up, and I'd like to pass the baton back to Megan, who started her diving in 2013 and was hooked after a single dive. She has enjoyed shipwrecks from the St. Lawrence to Sodus and all of the warmer climates. She loves teaching people how to help others, and she has great experience in rescue diving and with React Right, CPR, and alike. Megan, it's yours.
Thanks, Gene. All right, guys, so I'm back, and I know we're running over, so I'm going to try and keep it short and sweet. Can I get to my slide, Dave? There we go. So decompression sickness, also known as caisson disease, because a Frenchman came up with it, so they've got to have awesome names. Basically, this is where you've come up too quick. You have nitrogen in your body that is no longer being kept in your tissues by the pressure of the water, so it's got to go somewhere. So the easiest place is for it to come out of your tissues and into your bloodstream. All right, and that causes bubbles. Think like a soda can. Lots of bubbles if you come up too quick. So we're going to keep it short and sweet. We're going to talk about the signs and symptoms, and we're going to talk about treatment and prevention. All righty. So signs and symptoms. Let's talk physical first. We're going to get into pain in a joint or a muscle group. It doesn't like to, its bubbles expanding rapidly, and they don't like to do that in the body. It can cause stroke symptoms because you're having a air bubble travel to your brain or to a artery branch that it doesn't want to get out of. It can also travel to your heart and cause disruptions with how that's working. So it can look like a heart attack. All right. There are a lot of different descriptions and ways that this can present. So look in your book for all of them. If you want to learn some more about them or talk more in depth, we can talk afterwards, or we can talk in a React Right class, because knowing how to help someone is the next part of this. So something's happened, you've come up too quick for whatever reason, whether it was planned or not. you've made it to the surface and now someone's not doing so well. Usually it presents pretty quick, but it can take a little bit longer too. So treatment, you're going to treat this person for shock. They are not going to be oriented to time and place. Usually they're not going to be comfortable. They're going to be in a lot of pain potentially. And then their vital signs are going to go wacky. If you don't know what normal is, we can talk about it, but people are not going to be themselves. They're going to need treatment for shock. React right for that. We can talk about it then. And then prevention. Prevention is key. Don't beat your bubbles to the surface is the absolute first one. Keep breathing, but also take your safety stops. So if you've taken the deep course, you know that your first safety stop coming up is for 3 minutes at 60 feet. You're going to stop there. You're going to start to off gas then. And the longer you've been diving, the more you learn just to come up nice and slow. If you're on a wreck, maybe you've got good stopping points, or a reef where you've gone down to your 100 feet and now you're coming up to 60 feet-ish, and you can swim along the reef for 5-10 minutes and expand your safety stop, but continue your dive. And then once you come up beyond 60 feet, you stop at 15 feet for 3 to 5 minutes. And if you can find something cool to look at that depth, great. Hang out there longer. If you're feeling sick or you're not feeling well, let somebody know. If something feels wrong at depth, don't stay at depth. All right. And if something happens on a boat, don't try and recompress the person. The treatment for this is going to be treatment for shock and getting them to the next advanced medical care you can. A lot of times it's 911 and a paramedic is going to come and start treatment, giving them oxygen if you haven't already, making sure that their heart rate is okay and stable, and if they need to do something, they can give them medications above and beyond first aid. And then getting them to a hospital where a doctor can take care of them. And if necessary, getting them to a recompression chamber. All right. The hyperbaric chambers are prevalent, but they're not all accepting emergency patients, because when you get somebody that needs to be recompressed, it takes a huge team to make that a successful life-saving endeavor. All right. And I think the other biggest thing we have to talk about is we all love to travel, right? Because there's not so many beautiful coral around here in upstate New York. So we go diving in other climates and other places and around the world to see what we can't here. When you go diving, you need to not fly for 24 hours after a dive. This is especially important after multiple days of repetitive diving, because you have more nitrogen in your system that you've been building up over each dive, over each day, that you haven't gotten rid of it all yet. It takes 24 hours to get rid of it. So for safety, always plan your last dive of your trip to be 24 hours before you fly. It's a very bad thing to suddenly be at less atmospheres than you were even at the surface, and now you need medical treatment for decompression sickness. And maybe they didn't know you were diving, so they're going to treat you for something else because they didn't know that this was the lead up event. You went diving and now you're sick. So on to the next person. Let's see who's up.
Joe Perry.
It is Joe Perry, my dive buddy from the Niagara. All right, Joe, this is your turn.
Okay, thank you, Megan. I'm here tonight to discuss the causes and effects of nitrogen narcosis, as well as what we can and cannot do about it. As Jeff mentioned in our previous session, Jacques Cousteau called it the rapture of the deep. Today, we refer to it as nitrogen narcosis. You may have heard the term somebody being narked or getting narked while on a dive trip or in a discussion about diving and wondered more about it. Nitrogen narcosis is a diminished thought process caused by the high partial pressure of nitrogen in our breathing gas. As we discussed last session about Dalton's law, the partial pressure of our breathing gas, oxygen and nitrogen components increase as we descend. The deeper we dive, the higher the partial pressure. Also, the longer we spend at depth, the more time the increased partial pressure gas has to enter your body. At some point, this will begin to have a negative effect on our judgment and reasoning processes. What we do know is that high partial pressure of nitrogen creates an inability effect on the brain. The conscious centers of the brain seem to be very sensitive to this narcotic effect. As Bill has mentioned and Dave mentioned, the brain is one of the first areas affected by your blood because it's defense, but it's also affected by the blood having a higher nitrogen buildup in it. It's one of the first signs of decreased mental capacity will be shown because of that. On the slide here, we mentioned that there's 4 theories caused behind it. The irony is, well, basically, these all deal with how your body reacts under the increased partial pressure of nitrogen in your bloodstream and how it interferes with your normal brain activity. Although it isn't fully understood why the same diver at the same site on a different day can be more or less susceptible to the effect, it appears that there isn't one answer to the condition, rather combinational of multiple factors that come into play. For example, 2 divers at the same depth or basically the same physical condition can be affected completely differently. This has led to why the several theories mentioned and the lack of a definitive answer to date. It is very important to keep in mind that all divers are susceptible to nitrogen narcosis. Nobody is immune. That is a key point about nitrogen narcosis. There are many predisposed factors that can contribute to the onset and the severity of this diminished effect. The factors can and but are not limited to rapid ascent or descent. Again, everything keep it under control. Cold water, certain drugs, reduced visibility. It's always good to have a reference point. Inexperience, task loading, that's trying to do too much at once. Lack of sleep, exertion, that could come under heavy currents and stuff. So just trying to be in control of your dive. As you can see by these factors, that most can be controlled by being prepared for your dive and to dive within your limits. One of the greatest dangers of nitrogen narcosis is that the effect is often slow on the onset. It can almost be undetectable to the diver in the beginning stages. This is why safe divers need to be aware and realize the possibilities. Okay? And watch for the effects, especially when diving deep. In most severe cases, it can result in a loss of consciousness, and it's not a good thing if you're at depth. Another reason, stay with your buddy and alert at all times. Let's take a moment to talk about some of the more typical symptoms. They include, but are not limited to, relaxed feeling, lightheadedness, euphoria, slow response, increased error in judgment, fixation. You get the idea. As you can see, not all these seem to be negative. Who would want increased relaxed feeling and euphoria? That's basically why I dive. But keep in mind, though, that the reduced capacity and judgment are often start slowly and will increase if they're not addressed. Some of what we know is usually this appears after 66 feet, but keep in mind, everybody's a little different, so it could happen at any depth. So to minimize, to prevent and cope and adapt to nitrogen narcosis effect, just always dive within your limits. Try to reduce your stress before and after a dive. Keep your tasks fairly simple. Take specialized training to increase your comfort level. Avoid alcohol 12 hours before a dive, and I stress the word before you dive. In summary, safe divers should keep nitrogen narcosis in mind whenever they are diving, even more so when they're diving deep. Keep in mind the signs to look for. Oftentimes, ascending slightly will greatly and quickly reduce the effects on the brain. This is also another great reason to be in constant sight and communication with your dive buddy. Often they may be the one to notice the onset and react accordingly. If you believe your dive buddy is affected by nitrogen narcosis, you could simply signal an issue they need to ascend some. Perhaps signal an issue you could draw your buddy's attention to the need to do a controlled descent. Next up, I'd like to introduce my most frequent dive buddy, Daryl Jacob Moore. He'll be discussing another topic related to diving physiology in our Science of Diving program. Daryl is a very knowledgeable SSI instructor here at RU for Scuba with several specialties under his belt. Daryl, over to you.
Thank you, Joe. And Dave, how are we doing on time?
Oh, we're a little over, but as long as everybody's good, let's keep going.
We will. And I'll hit the key items. Next slide, please. I'm going to talk about effects of oxygen on the diver and central nervous system oxygen toxicity. Next slide. So this is a snapshot from a YouTube video. And in the presentation, this was done by Divers Alert Network in Southern Africa, a particular doctor, Dr. F. Cronje. So I want to give credit to that presentation. So this really sums up a lot of what we've heard over the last couple of nights. To the left, you have asphyxia or hypoxia, where partial pressure of oxygen moves to the lower side, not sufficient for good bodily function. And to the right side is in toxicity. So heavier loads where the body begins to react in a negative way. If you take a look on the left, the 0.21, this is your oxygen at a single atmosphere, and this is what we breathe every day. If you move further, thank you. If you move further to the left down to 0.1, you're probably several minutes away from dying, basically. That's what'll happen. So on the toxicity side, let me point out the 1.6. We'll talk about that a little more in terms of the maximum safe amount of partial pressure that we ought to subject ourselves when diving. And just a comment on the toxicity levels going out to 3. This is where the doctor begins talking about hyperbaric pressure. So you're able to sustain some very high partial pressures for certain periods of time under the care of the team in a hyperbaric chamber. So next slide, please. So hypoxia, so not enough oxygen, some of the physiological types and causes. In the left quadrant is hypoxic or arterial hypoxia. So this is where the arterial blood is too low, the partial pressure in the arterial blood is too low. This is the most common type of hypoxia. And you've heard it earlier tonight, high altitude. Also, equipment delivers inadequate or no air supply, running out of air at depth, overexpansion, lung injuries. The next one down is anemic hypoxia. So you have insufficient hemoglobin to carry the O2 into the body cells. So in this case, your lungs are fine, but the blood's ability to carry the O2 is diminished. And this could be due to carbon monoxide poisoning or blood loss. Up in the right corner, stagnant hypoxia. This is also called circulatory. And that's because while your lungs have taken up the oxygen, the oxygen can't be pushed out into the cells. So the lungs are fine, the blood delivery system is fine, but something else is going on. And in this case, it's generally pretty serious. Decompression, sickness, air embolism, heart attack, anything that impedes normal circulation. And finally, histotoxic hypoxia. So in this case, your lungs are working, the blood is okay, the circulatory system is fine, but the cells are unable to take the O2 and use it. This is because they've been poisoned in some way, and cyanide poisoning would do this, carbon monoxide. Some of the symptoms of hypoxia: cyanosis, so bluish tinge to the skin, numbness, tingling, loss of coordination, and consciousness. So again, this is not having enough partial pressure of oxygen in your body. Next slide, please. Hyperoxia. So this is having too high a level of O2, partial pressure of O2 in your system. And in particular, I'm talking about central nervous system toxicity. So some of the key points to think about: this is generally not an issue for recreational divers. if you take the enriched air nitrox course and use nitrox, this will increase your partial pressure of O2. And in that class, we teach all about how to deal with that. And something interesting, the function of how partial pressure of O2 impacts the body, it has to do both with the concentration, so the partial pressure, and also the time of that concentration. So when the scientists have talked about a 1.6 atmosphere of partial pressure of oxygen, they're looking at a single exposure of 45 minutes. And in most cases, that's going to be a safe level for divers, okay? Now, SSI is going to be a little bit more conservative with that and recommend a 1.4 atmosphere partial pressure of oxygen. And that they'll look at 150 minutes in a full day period. And this aligns better with repetitive dives, something you'd be doing over multiple days on a dive trip. Physiologically, O2 toxicity, my sense is that it's not entirely understood how this all takes shape, but it begins in the lungs. There's a decreasing ability of hemoglobin to transport the O2. So again, I'm reminded of anemic hypoxia. Your ability to eliminate CO2 is diminished, and then there's a cascading series of impacts. If that makes it to the brain, then you've got some real challenges. Factors that will lower your tolerance: exercising at depth, thermal stress. David spoke about this, medication, drug interactions, and again, individual divers react differently. So just know yourself. Another piece from the Dan presentation that I found quite interesting was the acronym VENTID. I think our book has 17 symptoms, and so I found this quite targeted. So vision, tunnel vision, spots or flickers, ears, ringing, nausea, and I'll speak about that a bit more in a second, twitching in the lips, irritability, unexplained anxiety, and dizziness. Nausea, they found in their testing, about 37% of the time, nausea is part of the symptoms. And so the recommendation is that if you're down in the water for 15 minutes or more, and you know you're at a partial pressure of 1.4 atmospheres of O2, and you begin to have nausea, you ought to take this as a sign that you ought to move up to shallower water and take care of yourself. It would be terrific if these symptoms showed up for you before anything happens serious, and then you could react to it. However, often the first symptom is convulsions and seizures. And that's not an issue in a hyperbaric chamber under medical care, but it certainly is if you're down at 100 feet and you can't breathe, and then essentially drowning becomes the key risk factor. So what do you do? Next slide, please. What do you do to prevent and deal with hypoxia and hyperoxia? Well, plan your dive and dive your plan. You've heard that from the beginning of your diving. Monitor your air supply at all times. That's why we're so focused on that, particularly with new divers. Know what you're breathing and have a good air supply. So go to a reputable dive center for tank fills. Consider the nitrox certification. Never hold your breath. Keep your equipment well maintained. Proper ascents. Know and practice out of air procedures, and you'll get more of this training if you were to take the deep class, for example. But again, this is about working in and out of the water with your dive partner and making sure you understand what needs to happen if you get into a low air situation. And you're already well on your way with this class, and go diving. Jim.
Sure. So, hey, Dave, I was thinking maybe we'll save this for next time because we're going long. After the last session, a bunch of people wanted me to go into the SSI awards for experience and training. So I think let's just save that because we're about 20 minutes over.
Yep, we are 20 minutes over. Okay, so the good news is we had some pretty awesome presentations. I'm always amazed by the knowledge of my fellow divers. So let's unmute everybody. Hang on. Okay, I think everybody's unmuted. Well, I still see people looking like they're muted. No. Okay. Does anybody have any questions on the presentations that we just heard?
I just wanted to say that I wanted to thank the instructors for putting out outstanding presentations.
Well, thank you very much.
Welcome.
Yeah, we had a lot to say and we ran over a little bit, but thank you guys for being patient. We kept almost everybody.
So a reminder, Dave, next Tuesday, right, is the next session.
Next Tuesday.
And is it dive theory, if I remember correctly?
Well, just 1 minute.
Oh, do you have a slide even? Oh, look at that.
We are going to talk about decompression theory. And then next Thursday is the total diving system, which I think we're going to be focusing on equipment that day.
Right. So yeah, so Thursday, you know, you'll have to bear with us. We're going to try something. So Don's going to walk you through rebuilding a regulator. So we're going to try this live, and with social distancing, no one's holding his phone camera for him. So we'll see how that goes, but we're going to try and make it fun.
We have a couple of backup if things go wrong.
Okay.
Hopefully it's not.
Don, Thursday, are people going to understand where Daryl got his nickname of Dirty Daryl or Dirty Diver Daryl?
No, we won't.
I hope not.
Oh.
How's that regulator coming?
That regulator polished and cleaned.
All right.
Daryl, we love you. But I bet next Tuesday,
Do it a little more often.
yeah, next Tuesday, we may get to know how Joe got his nickname of Deco Joe, which is, by the way, one of the best ever dive nicknames.
Deco Joe, yeah, they did appreciate that at the dive shop and stay show.
So a lot of the value that you're seeing here is the value of why you need a computer.
Right.
Well, we have computers. Otherwise, how would we be watching this presentation?
Wrong
Dun,
time.
dun.
Oh!
So now's the time. If anyone has any questions, you're unmuted. Shout them out, or if you don't want to shout out, there's the chat.
I have a question that's slightly related, but it has to do with SSI.
Let's shoot.
Okay. So we went on, like you said, to the SSI website to update everything and to like update our dives. And it says that we have to have them verified. Is that something you have to do for us?
Let me take control here for a second, Dave.
Go ahead.
You have to unshare, unfortunately, because this is Zoom.
Okay, stop share.
There we go. Now, let's see. Are you seeing a screen with some silver boxes on them?
No, we're seeing you, sir.
Still seeing me? Oh, because I have to press the share button. That's what that big button does. Got it.
Oh, there we go.
Now
Okay.
we're seeing silver boxes.
All right. So if you just go to the website, reforscuba.com, up comes the basic page here. All right. So under dive sites, there's a tab that says scan QR code, and it presents a giant QR code. If you are logging your dives in the app, all right, all you need to do is scan that. So the thought that SSI had, that I will not comment on my personal thoughts of the wisdom of how they implemented it, was that you always have a dive buddy with you. So when you're diving with them, if you had a paper logbook, you could have them initial it or sign it, whatever it may be, right? In the digital age, they thought that, oh, well, each diver has a unique diver ID, and they can make a QR code out of that. And so you could scan back and forth. And, you know, when I've seen people with phones on boats, they're usually tucked away in the driest part of the boat. They're not out trying to scan each other's phones. So a dive shop's QR code can automatically basically override your dive buddies. So if you go to your phone, pull it up to that screen, it should be able to read that QR code from within the Dive SSI app.
Okay. And do we have to log all, because we haven't logged our dives in the SSI book. We've just kept our own log.
Mm-hmm.
But we just wanted to like change the number.
Oh,
so
you can just
it's a
change the
little bit
number.
more-
Yeah, you can just
It
change
said-
the number.
They wouldn't
And it-
let us.
Oh, okay, I can change your number, so just shoot me an email or a text or something, and I can change the number.
I mean, it's not a big deal. We just wanted it slightly more representative of what we've done.
Sure. The other thing, I think I told you some wrong information. You know, when we dive professionals log in to Dive SSI, we have a slightly different view. That's where I was, slightly different view than you guys do. So let me get back here. Oh, too far. So we can either log in as a shop or we log in as our accounts. So our accounts just look a little different than yours. So we have some more rights, etc. So I can do things like I can change the number of dives. One thing I said last time about adding non-SSI cards is when I went to look at somebody, I think it was Pat. You said I could look at you, right? There was a button that says add non-SSI cards to your account. Apparently, you can't do that. I have to do that, or one of the dive professionals have to do that, because we're responsible in verifying that you actually hold that rating. So like we've seen your C card or a signed off logbook or something like that, which makes sense now that, you know, you think about it. But when I went online the other day and showed people, oh, you just go right here and do it, that's why. So.
Thank you.
Yep.
Hey, Jim, I've got a question about oxygen. I do a lot of work in the safety arena, and we always look at a range, a low level of 19.5% oxygen, and then go to the normal range at 20.9, and then we worry if it's over 23.5. And this is at atmosphere for an industrial application.
Right.
And I always try to talk to my folks and talk to them, for instance, general aviation pilots without cabin pressurization can fly to a ceiling of 10,000 feet.
Mm-hmm.
And it has to do with the partial pressure, correct?
Sure,
And
absolutely. And
so-
it has effects if you go diving at altitude.
Exactly. So what I was trying to do is relate it to the percentage of oxygen, which in essence, the amount of oxygen at 25,000 feet is the same. It's just there's less molecules, correct?
Correct, because the density, yes. So there's less pressure.
So if I was to talk to someone, is there some way I can relate this? Because we look at hypoxic conditions anywhere below 19.5.
Mm-hmm.
If I was to take someone up to 25,000 feet, let's say, what would that be like? Would that be like putting someone in an environment that had 8% oxygen?
Right.
Is
So
there any
that's
way to,
yeah, that's a great question. So the math on it would be one atmosphere is 14.7 psi, right? So you would have to figure out what the air pressure is at a particular altitude.
okay.
So I am an altitude dive instructor. I met the minimum number of altitude dives to get that rating, and that was something like 23 years ago. Since that time, I have not thought about altitude diving. To be brutally honest with you, right? So I can dig up in the materials. So there's a formula to figure that out, right? And so once you know the equivalent pressure, so I'm going to make a number up. Let's say it's 8 psi, right?
Mm-hmm.
From then you can calculate the partial pressure and then figure out
Okay.
the partial pressure of the entire gases. You can go to 100%, and you can do the math on it from there, right? I would have to look at a reference book myself.
Okay, and the second question I
But
had
just one note, dive computers do that for you. If you're diving at you're in Vail you're at 11,000 feet and you want to dive in a beautiful crystalline.
Might have a better insight on that too, Jim. Might be Jeff Munn, being the pilot and the diver.
Oh, hey, there's Jeff. We're going to give you homework for Tuesday.
Yeah.
If I noticed you weren't paying attention, that's perfect.
I was listening intently.
And the other question I had, did I read something wrong? But it said something like, as long as the cylinder contained 10% oxygen, it was acceptable? Did I miss something?
Acceptable for what? Not supporting life?
Well, it said the minimum level to support life is 10%. And we're
616. Well, that's consciousness. Consciousness, life.
I'm just 16.
Is it the 0.10, partial pressure of oxygen?
Yeah. So applications, right? So we're recreational divers, right? That means we put tanks in our back. We stay relatively shallow. We swim around and see the shipwrecks and the pretty fish, right? There's folks who are technical divers who are going very deep, right? And you start using different gas mixtures, right? So they may be using a gas mixture that doesn't have enough oxygen to support life on the surface. So when you're down at multiple atmospheres, if you're at 10 atmospheres, right, the amount of oxygen and air around us right now is, let's call it, for math's sake, say 20%, it's 20.9, but 20%, right? You would have equivalent of 200% at 10 atmospheres, right?
Yeah.
And so oxygen actually becomes toxic at a certain depth.
Okay.
Right? When you exceed the certain partial pressure, you can't do that in the surface because we don't have enough pressure unless you go into a pressurized container. Right. So that's why I do stuff like that. But that's the main difference between a recreational diver and a technical diver. So first of all, technical diver, there's a more technical level of knowledge needed, and there's a higher level of risk. And so you're starting to do things that are a lot more like mission oriented. I want to describe it that way to use some military terms, than going with some buddies to swim around and see pretty fish.
Yeah. Well, when I was with the utility, I qualified a couple of underwater welders to put new fuel racks in the spent fuel pool at 9 Mile 1. It was only 30 feet deep, but they didn't need lighting because of the Cherkov's radiation. So yeah, there was a level of risk there.
That's a different level. Yes, exactly.
Yeah.
Right.
But they were professional divers, and you just wonder about that particular risk. So yeah, okay, but that answers my question.
Yeah. And I don't know what it is with underwater welding, but we normally get like a lot of high school kids, high school boys usually, that it must be like considered a He-Man macho job or something like that, right? I'm going to be an underwater welder. And then they realize that you're going to be welding in things like, the manure pit for the pig farmer and places like that. So it's not exactly a glamorous lifestyle.
Or a spent fuel pool at a nuclear power plant.
Exactly.
Yeah, or else you're welding on some oil tanker in the harbor that's full of slime and sewage. So yeah, not very glamorous. No. All right.
Unlike
thanks.
all
That's
of us
helpful.
recreational divers who are full of glamour. I mean, look at everyone. This is a good-looking crew we got here.
Olympic.
Oh, I'm sorry. I had filters on.
Any questions? Anybody else have questions they want to go over? We can also do, if anybody wants to stick around, we used up a little bit more of your time than we anticipated, but I'm happy to stick around and go through review questions for section 2 if anybody wants to do it.
How is everybody doing on their homework?
I'm up to number 5. I think that was the underwater part of it.
Okay. So you got through section 2?
Yes.
Everything makes sense to you with the review questions and everything? Good.
So Dave and I were chatting earlier today about, okay, so we have this this science of diving class that SSI very graciously turned on for free for people, which I thought was pretty cool of them, right? And so we're like, well, what's next, right? So we seem to get a lot of folks asking about the SSI app. It is not the most intuitive app, right? So we were thinking maybe we'll do a session, just get people on some random Tuesday, and then share our apps, both Android and iOS, and show people how to use it and answer people questions, around that. We were also thinking about, maybe there's some more fringe gear that people may be interested in learning more about, like full face masks, and why would you use those? That type of thing. And maybe just say, hey, each of the instructors, everyone gets something that may be a little bit out of the mainstream, but still recreational, and talk about those some days. Are things like that interesting? We figure we'll just kind of do a social thing as time goes on until we can actually get in the water together.
Yeah, that'd be great.
Great, yeah. Yeah.
Right. I mean, maybe Don, you could talk about, you basically made the transition from diving with a standard BC to a back plate, and you're loving that. And, so maybe you could talk about your experience with that and explain what back plates are and that kind of thing.
So. Yeah, definitely. It's interesting. Throw it out there, and, be it whatever specialty or something like that. If somebody wants to learn more about something, just let us know.
Right.
Considering we can't get in the water.
There is a chat question from Bert about how to get Nitrox training class on SSI.
Sure. So Nitrox, just so to ground everybody, I think most people probably know what it is, but with Nitrox, you're diving with a gas mix that has a greater concentration of oxygen than we have here, and the advantage is you can stay down longer at shallower depths. Right, so I couldn't quite see the chart on the wall from here, but by the idea, if you're diving down to 70 or 80 feet, you may get, I don't know, pick a number, 40 minutes. I know if someone has a chart handy. And with standard air and with Nitrox, you can get an hour. And depending where you are in your diving career, at some point, you will you'll be limited by your nitrogen absorption rather than the amount of air you can carry with you or amount of gas you can carry with you, right? And at that point, it's especially important to, if you want to maximize your dives, to start switching different gas mixes. So how can you do it? It's a class like any other class where we could turn it on through the app. What's interesting, and Dave, I haven't read the most recent update. You mentioned it the other day to me.
Don.
There's Donna's full face mask. Right. But Dave, you mentioned, right, so didn't SSI update the standards a bit? That
they did.
It's mainly an online course.
They have the Nitrox 32. It's 100% virtual, and all you need to do to upgrade to 40 so that you can, use really any mixture is to do that tank analyzing together once we can get together. And it's pretty easy.
So the class itself is 4 chapters. One, it gives you the kind of overview, the history. Chapter 2 talks about using the most common mix, which is 32% oxygen, right? Nitrox 32. And then if you want to be able to plan dives for other mixtures, right, that's what chapters 3 and 4 get into, right? So the first 2 chapters cover probably what we dive 90% of the time. Mm-hmm. Right. Most dive resorts will have bottles of 32 ready to go. Right. Max operating depth, about 100 feet, but if you're going, say, on the St. Peter, which you can get down to 117, right, you couldn't use that. Right. We dive Nitrox with, and this is all tied back to what we did the other day, of a partial pressure of oxygen of 1.4. Right. So if that didn't make any sense, go back and review the first chapter, right? But in Nitrox class, it gets into that again. And then you would dive the St. Pete, you would probably need a mixture of, I can't do the math off the top of my head, but 27%. Can't look at the chart either, something like that. And so it gets into how to calculate all that kind of stuff and a little more math in chapter 3 and 4.
And you really want to be able to calculate that maximum operating depth, because you don't want to have your health and safety put in the hands of some dive shop in Honduras. So analyze the tank, know how to calculate that maximum operating depth.
Right.
The easy way is your computer tells you MOD. You
Right.
punch
So
in what blend you're using.
Right. Michelle said, couldn't you still use ordinary air? Yeah, absolutely you could. But what happened, the difference is, once again, I'm going to just make up these numbers. Let's say you get 12 minutes on a tank of air, nitrogen loading with 12 minutes at 130. On that nitrox mix, you could get 20 minutes, something like that.
No, that doesn't include more pressure. The tanks are still 3,000 PSI.
Right.
The PSI is 3,000 PSI. So if you breathe heavy, you go through air fast, then you're still going to go through the air.
Right. It's for the point where you are in your diving career where you're limited by your nitrogen absorption, not the air in your back. Yeah. So, and another application for nitrox is when you're going either on a liveaboard or on a very dive-focused vacation. So not necessarily a vacation where you'll dive a couple of times, but you're going on a bespoke dive trip. So we brought a bunch of people over to the Philippines this past year, right? We were diving 5 times a day. We were getting in, what, 5 to 6 hours underwater a day? Something like that.
It was a lot.
Yeah.
So you're bringing a lot
It
of
was
nitrogen
glorious.
into your system. So you want to, dive as much as you can. So you need to use nitrox so you don't have any problems with reaching your maximum NDL.
Hey, Jim, when I was telling you guys before we started out about, we sat down one time and we were doing the calculations together. I don't know if we were on a trip or we were in the shop or what, but there was actually, it paid off to take the nitrox class for more dive time on your dive vacation because and it was a significant amount of time.
Yeah. So that was when we had an SSI like kind of regional manager, RJ. It was a guy named RJ, and he came in and he said he asked us, "Hey guys, do a lot of nitrox fills?" We said, "Well, in our area, the dives that we have tend to be a little too deep." Right, so for like the St. Peter, most people will just use standard air on that, and then the next wreck, the landing craft over in Ontario, that is 80 feet, so it's relatively small though, so you don't really need the extra 20 or 30 minutes on it, right? So we don't do a lot here. So when we go up in Thousand Islands, you go on a trip, and so RJ lives in New Jersey, where they have a lot of wrecks. Right, and you have to get on a boat at like 3:30 in the morning to make it out far enough to go on the wreck. So when they're there, they're diving. And he was explaining the way that he always looked at nitrox. It was a money saver. And so he said, "What do you mean?" Right? So I said, let's say you're going on vacation, right? And traditionally on a dive trip, it would be you go in the morning, you go on a deep dive, which tends to be relatively short. The second morning dive tends to be deep by the definition of above or below 60 feet. And then you break for lunch, and then you go on probably a 40 to 60 foot dive, and then you go in for a 30-foot dive, right? If you do that every day, right, you're going to start building up residual nitrogen in your system. And so you're not going to dive for the entire length that you could possibly dive. So if you can only, say, dive for an average of 40 minutes, right, over those 4 dives, right, versus being on nitrox because you're absorbing so much less nitrogen that you can get an average of an hour, right, each day it's like picking up another dive and a half. Right. And so looking at that way, it's like, and if you did say a 20 dive package with somebody, it's almost like you got 26, 27, 28 dives out of it. So in the Philippines, I personally did like 51 dives, and I think I had like 63 hours underwater in a 2-week period. Right. And so if I was on air, I couldn't have done that much. So the cost per minute underwater, if you're looking at it from an economics point of view, is far lower. If that made sense.
It is when you're traveling halfway around the world and you're spending a significant amount of money to go on a trip.
Yeah.
The more time underwater you can get, the better it's going to be, if that's what you're going.
Yeah.
Well, Joe always gets in, dives all day long and night dives, so
he probably was laughing at Jimmy's 40 dives.
I tell you though, I'm glad that Joe and I went diving when you guys went hiking.
Yeah, but
That was a great hike, though.
we got to go into a volcano.
Yeah,
It's a great
I
dive.
saw how y'all looked when you got back.
Have you seen the photos from that volcano?
It looked awful. I was so relaxed. I had a nice dive. We had so much time before you guys came back all sweaty, except for Dean. Dean was like, I thought maybe he quit before you guys did or something.
Oh no, he sweats like a pig, but he just dries quickly.
Oh my, yeah, but he was back so much earlier than everyone else.
It's because he didn't want to explore afterwards. He just left.
So to clue everyone in, when we went to Station in February, the way the dive and the flights timed out, I had planned a hike to an extinct volcano. We could actually go down into the caldera, all that kind of stuff. So it was cool. I figured, okay, it's the last day. You need that 24 hours before you could fly. And then we realized our flight was something like, I don't know what it was, at 2:30 or 3 o'clock in the afternoon the next day. So you could actually get another morning dive in. And so a couple of people decided to get the dives in, and the rest of us hiked. And I think we were both happy with our decisions.
Joe, I saw the whale shark, right?
Yeah.
The dolphin.
On that station trip, though, I actually did hear a whale. Of course, we didn't see it. But on, I think it might have been a bluebee dive. One of the dives there, very distinctly, I heard a whale. That was the first time I ever heard a whale, and it was such a cool experience.
That was Jeff eating 2 burritos.
No, I checked all that out.
Yeah, where's your blue bee, Joe?
I got it upstairs.
I
take it into a bracelet yet, I guess.
Yeah,
so a week or two after that trip, they spotted a whale.
Oh, wow. Yeah, I saw that.
So Joe, tell the story about the blue beads and what the deal is with them. And
well,
in Bon Air, right, Joe?
No, this is down Statia. There's
sorry, my bad.
The historical part of it is back in when emancipation was at the islands around 150 years ago. The slaves used these beads as well. The slave owners rewarded the slaves with beads when they're doing good things and chores. It's just a reward system. The slaves used the beads to trade amongst themselves, for different products and stuff and food, whatever they wanted. A slave couldn't marry unless he earned enough beads to put around his prospective bride's waist. So they were incentivized to earn these beads. Anyway, when they were freed, they threw the beads into the ocean as a sign of freedom and celebration. They threw them into the ocean. So now the divers, there's a dive we were able to do called the Blue Bead Hole, and you just go in this area. It's probably 20 feet deep or so, and just look for these beads. There's these fish called gardens. There's a fish that actually got they got like wings on them. Flying Gurnards, and they got like wings on them, and actually stir up the bottom of the sand, and they'll free them up once in a while when you can see them. So we spent a whole dive just scouring the bottom looking for these beads that have been down in the water for 150 years, and I was lucky enough to find one. So that's the only artifact you're allowed to take from Statia is these blue beads.
There's a flying Gurnard.
There it is. Yeah.
Huh. Ooh. Yep, they're very cool.
Yeah. But now, though, you're cursed though to have to go back. Isn't that the thing with it?
It's not a curse. It's not a curse.
No, yeah. I liked Statia. That was nice.
Yeah.
I would go back.
It was very different than other Caribbean places.
Yeah, because they were all deeper dives. There wasn't any of that, at the end of the dive, you're at, 20 feet and you can hang around under the boat. There was none of that.
Right. Plus the island itself, right?
Yeah.
Besides their odd security system. It's just that, they don't get tourists there. So
even I'm sorry. Even like the turtles and stuff, though, they came right up to you. They weren't really afraid of divers. They were social. I mean, I had to get out of their way.
Nothing was. Even the shark.
I got that one picture of you.
Yeah. I mean, that was, it was pretty pristine.
It was, I enjoyed it. It was a little cooler and a lot more current than I expected.
Yeah.
Yeah, but Pat, I think that was just the time, because when we were in Curacao the week after, we had a lot of current, we had a lot of wind.
Look at Andy.
Oh, yeah.
I think that there was like a run or something going through.
Okay.
Dive Master said it was a really weird time.
Yeah.
So, well, folks, should we call it a night?
It has been a great night.
Yeah, I gotta go.
Thank you so much, everybody.
Thank you.
Thank you.
All right.
Next
See you
week.
guys Tuesday.
Yes, Cinco de
Have a good
Mayo.
weekend.
All right.
Have a good one, everyone.
Bye-bye.